I'm starting with medical mycology section, and the first part is general mycology, and then after covering general mycology I will move on to special mycology. At the end of this session you should be able to describe a fungus, its nutritional requirements, the structure of a fungus, especially there are various types of fungi. You should be able to name and classify various types of mycosis, differences between fungi and bacteria, and laboratory diagnosis of fungal diseases. Both of these are very important. What is medical mycology? It is the study of fungi causing diseases in human beings. What is a fungus? It is an eukaryotic organism, that is, it has a true nucleus. There is also a cell wall which contains chitin, and this chitin is composed of N-acetylglucosamine and beta-glucan. This beta-glucan is a long polymer of D-glucose, and the medical importance of beta-glucan is that it is the site of action of certain antifungal drugs, for example, caspofungin. Fungi also have a cell membrane which is composed of ergosterol, in contrast to human cell membrane which contains cholesterol. The selective action of amphotericin B and azole drugs such as fluconazole and ketoconazole on fungi is based on this difference in membrane sterols. Fungi also produce filamentous structures and spores, and we will discuss about these filamentous structures and spores later on. Nutritional requirements of a fungus. Most of the fungi are obligate aerobes, some are facultative anaerobes, but none are obligate anaerobes. All fungi require a preformed organic source of carbon, hence their frequent association with decaying matter. The natural habitat of most of fungi is therefore the environment. An important exception is Candida albicans, which is part of normal human flora. Differences between bacteria and fungi. Diameter, approximately 4 micron meter, for example in case of Candida, and the diameter of bacteria is approximately 1 micrometer. The example is that of Staphylococcus. Nucleic acid type, fungi are eukaryotic, bacteria are prokaryotic. Cytoplasm contains mitochondria and endoplasmic reticulum, whereas all of these two components are absent in case of bacteria. Ribosome is 80S in fungi and 70S in bacteria. Sterols are present in fungal cell membrane, and these are absent in bacterial cell membrane except in case of mycoplasma. So there is an exception. Cell wall content, chitin is present in fungal cell wall, whereas peptidoglycan is present in case of bacterial cell wall. Spores are sexual and asexual for reproduction purpose, and in case of bacteria there are endospores. They are just for survival, they are not meant for reproduction. Nutritional requirements. Fungi require organic carbon. There are no obligate anaerobes, and in case of bacteria many do not require organic carbon and many are obligate anaerobes. Method of replication in case of fungi, either by budding or mitosis, and it is by binary fission in case of bacteria. Thermal dimorphism is present in certain fungi. We will discuss what is this thermal dimorphism in the next slide. And in case of bacteria, there is no thermal dimorphism. So these are the differences between bacteria and fungi. There are various types of fungi. The first one is yeast. These are ovoid cells that reproduce by asexual process known as budding. Then there are molds. These are filamentous structures that reproduce by sexual or asexual method by forming spores. Then is dimorphic fungus. It forms different structures at different temperatures. It can form molds in environment or soil and yeasts in human tissues. Types of fungal filaments. Before that, you just need to understand what is a hyphae. It is an elongated thread-like branching filament of even width, and it grows by apical elongation. And if there is elongated mass of hyphae, this is called as mycelium. Now there are various types of hyphae: septate hyphae, aseptate hyphae, or choanocytic hyphae. Then there are vegetative and aerial hyphae. So these are the aerial and the vegetative hyphae. Then there are certain pseudo hyphae, false hyphae. So what is a septate hyphae? These are the hyphae containing cross walls, septa or cross walls, as you can see over here in this picture, which divide them into uninuclear cell-like units. In case of aseptate hyphae, you can see that there are no cross walls, no septa, and they look like one long filamentous structure, and they are multinucleated. So this is also known as choanocytic hyphae or aseptate hyphae. Okay, then you have these aerial hyphae, which are above the surface of the media, vegetative hyphae, which are submerged in the media, then pseudo hyphae. These are chain of elongated cells. For example, in case of yeast, they are formed by budding. The septa are curved, as you can see, and there is septum and constriction at the origin of branches. Cell walls are constricted at septum. If you compare this with true hyphae, like in this case, the walls are parallel, septa are not constricted, cell walls are not constricted at septa, the septa are not curved. So the pseudo hyphae is mostly formed in case of Candida, which is a very good example of these pseudo hyphae. Fungal spores. These are fruiting bodies produced for sexual or asexual reproduction. They are of two types: asexual spores and sexual spores. The asexual spores are formed by budding and mitosis, and these spores include chlamydospores, arthrospores, blastospores, and sporangiospores. Arthrospores arise by fragmentation of ends of hyphae. Chlamydospores are rounded, thick-walled, and quite resistant structures. Candida albicans is the example of these chlamydospores. Then are blastospores. They are formed by the budding process by which yeasts reproduce asexually. Some yeasts, for example Candida albicans, can form multiple buds that do not detach, thus producing sausage-like chains called pseudohyphae, and they are used for identification. We have discussed about pseudohyphae in our previous slide. They are not true hyphae. Then are sporangiospores. They are formed within a sac which is called as sporangium, and this is on a stalk. The examples are Rhizopus and Mucor. Then there are conidia, which are also asexual reproductive structures. They are present on a specialized hyphae which are called as conidiophores. There are two types of conidia: macroconidium and microconidium. Sexual spores. These are formed as a result of meiosis process. These are ascospores, zygospores, and basidiospores. Zygospores are single large spores with thick wall. Ascospores are formed within a sac which is called as ascus. Basidiospores, they are formed externally on the tip of pedestal which is called as basidium. The classification of fungi is based on their sexual spores. Fungi that do not form sexual spores are termed imperfect and are classified as fungi imperfecti. There are various types of fungal infections starting from superficial to deep, and then systemic and opportunistic fungal infections. We will be discussing all of these etiological agents one by one in detail in special mycology. The dermatophytes are important in systemic mycosis, especially the histoplasma. In opportunistic mycosis, Candida, Aspergillus, and Cryptococcus, they are very important. Laboratory diagnosis of fungal diseases. There are 4 approaches to the laboratory diagnosis of fungal diseases. Number 1 is direct microscopic examination. Then you can go for a culture, serology, and nucleic acid detection tests. Direct microscopic observation. This involves examination of clinical specimens such as sputum, lung biopsy material, and skin scrapings. And this depends on finding characteristic asexual spores, hyphae, or yeasts in the light microscope. The first test is potassium hydroxide or sodium hydroxide preparation. 10 to 40% of potassium hydroxide can be used, and the aim is to dissolve tissue material, leaving the alkali resistant fungi intact or stained with special fungal stains. Then is the calcoflow white stain, which binds to polysaccharides such as glucans and chitin in the cell wall. Fungal elements fluoresce under fluorescent microscope. The third one is India ink stain. There is a white capsule of Cryptococcus neoformans, which is observed with the help of this India ink preparation in spinal fluid. Then is gram stain. You can find budding yeasts with the help of gram stain, though you can also find hyphae and pseudo hyphae, which are not visible over here. And these fungal elements can appear as gram positive at times, but the size is bigger. So these are budding yeasts. Then is direct fluorescent antibody test. And in this particular case, this can be applied to a tissue or a viable or non-viable culture. Wright's or Gemza stain. Now these two stains can be used to find out intracellular fungus, for example, Histoplasma capsulatum. Then is use of certain stains like histopathological stains. For example, this is hematoxylin and eosin stain, and you can see different hyphae. Then is periodic acid Schiff stain. These are also fungal hyphae. Then is Gomori methenamine silver stain. These brownish colored are fungi. These are actually yeasts. So you can also find filamentous structures which are brownish in color. They are hyphae, and this is Gomori methenamine silver stain. And then is culture. In case of culture, the media is either Seborrhoeic dextrose agar, or it is Seborrhoeic dextrose agar with addition of certain antibiotics such as cyclohexamide and chloramphenicol. The Seborrhoeic agar is going to facilitate the appearance of slow-growing fungi by inhibiting the growth of bacteria in the specimen. Inhibition of bacterial growth is due to the low pH of the medium and to the chloramphenicol and cyclohexamide that are frequently added. Then is the incubation temperature, which is very important. 2 Seborrhoeic dextrose agar can be inoculated routinely at 37 degrees centigrade, which is the body temperature, and the 25 degrees centigrade, which is the room temperature. So one agar would be incubated in the incubator and the other one would be at room temperature. Usually the fungi are kept for 4 weeks and they are daily observed for 1 week and then twice a week thereafter, and most cultures can become positive in about 10 days. Identification of a fungus from a culture. Just like in case of bacteria, when there is a growth, you observe the colony's morphology and then you perform gram staining. Similarly over here, you would first notice the morphology with the help of naked eye. You would look for nature, color and pigmentation of the growth, which is the macroscopic appearance, and then microscopic appearance with the help of a stain which is lactophenol cotton blue stain. So if you pick up this colony, place it on a slide and add this stain and observe under microscope, you will observe fungi. Then you can also perform biochemical tests which are similar to that of bacteria. For example, urease test, fermentation tests, etc. Serology. Fungi are poor antigens, and this antigen detection is presently available for Cryptococcus, Candida, and Histoplasma. And you can perform these tests with the help of ELISA, complement fixation test, the latex agglutination tests, etc. Nucleic acid detection. This is for these certain fungi: Plastomyces, Coccidioides, Cryptococcus, Histoplasma. Summary: the cell wall of fungus is made up of chitin, unlike bacterial cell wall which is made up of peptidoglycan. There are three types of fungi: yeast, mold, and the dimorphic one which has the capability to become yeast in tissues and molds in soil. And the systemic classification of fungi is actually based on the sexual spores. For example, they are ascomycetes, basidiomycetes, zygomycetes, and mitosporic fungi. If you remember, I told you these are fungi imperfecti. They do not form sexual spores. Thank you.